Good day everyone, welcome back to Parasitology. This is Lesson 3, Phylum Nemathelminthes Part 3. So far, we are already done with discussing the nematodes that are acquired via ingestion, nematodes that are acquired via skin penetration of the filariform larva. Ngayon naman, we will be focusing on nematodes that are vector-borne, or in other words, the filarial nematodes. We can group our filarial nematodes based on their adult habitat kung saan sila napupunta as adult worms. There are those that reside in the subcutaneous tissue or under the skin, such as Loa, Onchocerca, and Manzanella species. There are those naman that live in the serous cavities or in the body cavities, such as other species of Manzanella, and those that reside in the lymphatic tissues, such as Wuchereria bancrofti, Brugia malayi, and Brugia timori. The diagnostic stage of all of these filarial worms would be the microfilaria. Siguro when we were discussing in lesson 1 or lesson 2, medyo confusing pa siya. Isa lang ba yung filarial worms sa microfilaria? Same lang ba yun? Or are they different worms or different life stages? The filarial worms are the worms, and one of their life stages would be the microfilaria, or in plural, microfilariae. They are described by Markel and Vogt as modified eggs. However, if you look at other references, they are already referred to as larvae. Kaya there could be some sort of confusion with that. Pero because we have a textbook, we will be following na lang what is described in our textbook, in which they are described as modified eggs. And in the life cycle of filarial worms, the larva would usually emerge when these eggs are unsheathed, or parang pag nawala na yung shell nila once they are in the vector or in the mosquito or fly or kung anumang intermediate host niya. So, ayun lang ha, for clarification, for the purpose of this lecture, we will refer to microfilariae as modified eggs of filarial worms. Bakit siya modified? Kasi 'di ba most eggs syempre oval, round, but microfilariae are serpentine in shape. In fact, ang shape na niya ay para nangang larva or para nangang worm mismo. So, serpentine in shape. They are filled with nuclei of many cells, or they are filled with nuclei across their body. Some are distributed, some are condensed, or some are crowded. And we actually use this as one of our clues when identifying the species. Aside from the appearance of their nuclei, pwede din yung the presence of their sheath or envelope and the capacity for it to be stained by GEMSA. So, merong mahabang sheath, may long sheath, merong sheath that has affinity for GEMSA, may sheath na no affinity for GEMSA. Meron din tayo tinatawag na cephalic space. The cephalic space refers to the first part of their anterior end or dun sa may ulo niya na wala pa munang nuclei. So, we use ratios for the cephalic space, wherein later we would see 1:1, 3:1. This means na kapag mahaba yung cephalic space, it would have a higher ratio. Kapag naman maikli, lower ratio yung makikita natin. The ratio is it is used to refer to the length of the space as opposed to the width of the space. So pag mahaba, mas longer siya, mas mataas yung ratio. Again, itong mga presence of nuclei, presence of sheath, presence of cephalic space, we all use these characteristics to identify the species. Kumbaga, when we talk about hookworms, we look at their rhabditiform morphological characteristics, adult worm characteristics. Dito naman, we look at the characteristics of the microfilariae to determine if it's Wuchereria, or Loa, or Manzanella. Speaking of, ito na po yung itsura of the different clinically significant filarial worms. We will be discussing them one by one. And this would refer to their cephalic space. Kung makikita nyo, yung iba sakto lang, yung iba mahaba yung cephalic space, yung iba shorter. And then, when we talk about the nuclei, there are some nuclei that would be found towards the end of the tail. Meron naman no nuclei in the tail. So, we will also review this later. Another important characteristic of filarial worms is their periodicity. Again, these worms are vector-borne, and their life cycle depends very much on the time that they are visible in the circulation and also the time that they are in the tissues. Kaya naman, periodicity refers to the fluctuation in numbers of microfilariae present in the peripheral blood during a 24-hour period. There are different types of periodicity: nocturnal, diurnal, subperiodic, and non-periodic. Nocturnal parasites would mean that there is a high number or mas mataas, or they are only present rather when they're only present in the peripheral blood during the night. So usually ito yung mga night, yung mga 10 p.m. ayan, to dawn, 2 to 4 a.m. Yun yung nocturnal periodicity. Pag diurnal naman, the microfilariae are present in the daytime, usually mga 10 a.m. ayan. Subperiodic, meaning they are present all throughout the day, but there is really that one specific part of the day kung saan dun sila pinakamarami. And then non-periodic, meaning wala talaga silang pinipiling oras. For our first group of filarial worms that we will discuss, it would be those that inhabit the lymphatic tissues. And so the common pathogenesis or clinical manifestation of these parasites would be lymphatic filariasis. This condition, lymphatic filariasis, is considered as a neglected tropical disease. What does NTD mean? Neglected tropical diseases are those that usually affect the poorest of the poor. Ayan. According to the World Health Organization, these are the diseases that affect yung mga poverty-stricken areas. And so, medyo hindi siya na napagtutuunan ng pansin. And so, they become neglected. Pero these are very important. They need to be addressed properly. Kasi syempre, we also have to, when we deliver healthcare or when we prioritize healthcare, it should be for everyone. So yan, neglected tropical disease. And here in the Philippines, naging endemic din tayo for filariasis. It is one of the most debilitating disease, and it is the second leading cause of permanent and long-term disability. The causative agents would be our three filarial worms, Wuchereria bancrofti, Brugia malayi, and later we will also add Brugia timori. Ano po ba yung lymphatic filariasis and why is it important, at ano ba yung lymphatic system? This is just a quick review of our anatomy. And when we talk about the lymphatic system, it is usually composed, or not usually, it is composed of these organs: the lymph nodes, spleen, thymus, bone marrow, tonsils, and their purpose is to drain extra fluid that have leaked out of our blood vessels. So, syempre, meron tayong mga, may plasma tayo, di ba? May blood tayo. And sometimes, the fluid from our blood vessels leaks out into our interstitial spaces. And we refer to those fluid kapag medyo nag-leak na siya dun sa ating tissues, ang tawag na dun ay lymph. And so, these lymphatic organs will drain that lymph and filter that if there's bacteria. May mga immune cells or may mga white blood cells din tayo that reside in our lymphatic tissues, and then bring it back to the circulation. So, if there is lymphatic filariasis, may mga filarial worms na nakatira sa ating mga lymphatic tissues. Ayan, it can block their function or it can affect their function. That is why one of the symptoms of lymphatic filariasis would be lymphedema, wherein mag-accumulate yung lymph dun sa ating tissues. Kumbaga, instead of dapat na-drain siya at naibabalik sa circulation, nasa-stock siya, dun naiipon siya at nagkukos siya ng pamamaga. So that is lymphatic filariasis. We'll discuss more about this later on. Aside from lymphatic filariasis, madami pa tayo parasitic neglected tropical diseases. And don't worry, madadaanan din natin yan later. So far, natapos na tayo sa soil-transmitted helminths, diba? Yung mga ascaris, trichoris, and hookworms. And strongyloides. So, neglected tropical disease system siya. Okay, so now we begin with our first lymphatic filarial worm, which is the Wuchereria bancrofti. The common name is Bancroft's filarial worm or Bancroftian filarial worm, and the host is man. Again, all the parasites that will be discussed in this video are vector-borne parasites. Kaya meron na tayong intermediate and final host. Previously, yung mga intermediate host natin would be the food na kapag kinain natin ng hilaw ay mahahawa tayo. Like in capillaria, di ba, when we eat the uncooked fish. Dito naman, yung mga intermediate host na babanggitin natin would be the vectors or the arthropods that would transfer the parasite to us during their feeding time or during a meal, kapag kakagatin nila tayo. Ayun. So, intermediate host, for this case, would be mosquitoes, particularly those that belong to the Anopheles, Aedes, and Culex genus. The habitat is the lower lymphatic system. Mode of transmission is skin penetration, pero, ayan na, insect bite / skin penetration. Kasi pag in-insert na nung bibig or nung proboscis ng mosquito sa skin natin, doon sila dadaan. Kaya skin penetration / pwede lang yung / insect bite. Infective stage would be the filariform larva, or it still applies for this group of parasites na the infective larval stage is filariform larva for the man. And then for the mosquito, the intermediate host, microfilaria naman. Mas maintindihan natin to later kung bakit ang infective stages ng mosquito ay microfilaria. And then diagnostic stage, also microfilaria. Because the diagnostic stage of Wuchereria bancrofti is microfilaria, we focus on their morphological characteristics. Here, we can see that the nuclei are regularly spaced. The sheath, there is a present sheath. However, this sheath is not stained, or it has no to very low affinity to the gems stain. There are no terminal nuclei, ibig sabihin regularly spaced nuclei pero hindi umaabot dun sa tail. Cephalic space is 1:1. Appearance is graceful, walang masyadong mga kulot-kulot, ayan, graceful. Anterior is bluntly rounded or tapered, and the periodicity is nocturnal and or subperiodic. Pag nocturnal, sa gabi lang lumalabas yung mga microfilariae sa ating peripheral blood, and that would be around 10 p.m. to 2 to 4 a.m. Kapag naman subperiodic, medyo they're present throughout the day, but they choose a specific timeline where they are most abundant. And for Wuchereria, it would be around noon to 8 p.m. So medyo nasa gitna, diba? Nasa gitna ng araw, noon to 8 p.m. And this is what they would look like under the microscope. I think it's a good choice naman, a good idea not to say it as early as now. Na saan po ba natin nakikita ang diagnostic stage? We see it in the blood. Okay. Therefore, when we look at the diagnostic techniques later on, we would use blood techniques such as thick and thin smear, Knott's concentration. Kaya dito makikita nyo, mga blood cells po yung nasa paligid. And here you would find the microfilaria of Wuchereria bancrofti. For the life cycle, for this round or for this parasite, we will have an in-depth discussion of the life cycle. But after this, as we go to the next parasites, very similar lang ang kanilang life cycle. Ang nag-iiba lang lagi ay yung kanyang habitat. So, I will do an in-depth discussion for this slide, pero in the following slides, sasabihin lang natin kung ano yung mga naiiba. Okay ba yun? Ayan, wala kayong choice kasi recorded na to. Kaya panonoorin nyo na lang. Ayan. So, it begins with skin penetration or insect bite of the mosquito. Ang ating vector for this parasite would be the mosquitoes. Kaya, ayan, kakagatin ka niya. Mag-aspirate na siya ng blood, but at the same time, part of its saliva would contain, the L3 filariform. So, pupunta na sa circulation, yung filariform. After that, it will migrate via the blood vessels. It will transport itself to the lymphatic system. So, ating mga lymphatic tissues, ayan, where they would grow into adults. For Wuchereria bancrofti, we said that the habitat is the lower lymphatic system. Okay, so lower na sa may mga paanan. Ayan, lower lymphatic system. And so, the male and female adults, kapag nag-mature na sila, will fertilize and copulate and produce the modified eggs called microfilaria or microfilariae. These eggs now migrate into the circulation or the peripheral circulation. Every time or every night, ayan, or 12 noon to 8 p.m., they would be found in the circulation. Paano naman kapag umaga, saan sila nagtatago? They hide in the blood vessels of the lungs. Again, when they are not in the circulation, you would find them in the vessels of your lungs. So, ayan na. Kapag dumating na yung mosquito, tapos sakto, medyo gabi, ayan, 2 to 8, noon to 8 p.m. o kaya 10 p.m. to 2 to 4 a.m., kinagat ka ng mosquito. So, nandun yung mga microfilariae sa circulation. As it aspirates your blood, nasasama yung microfilariae papunta sa kanya. And so, the infective stage of this parasite to the mosquito would be the microfilariae. Paano naman yung mode of transmission? Kapag nag-aaral ng parasitology yung mosquito, anong ifo-focus nila? For them, the mode of transmission would be ingestion. So, kakainin nila yung microfilariae. Once inside the gut of the mosquito, it will remove its sheath, yung parang pinaka-shell niya. It will remove its sheath and then penetrate the midgut and migrate to the thoracic muscles. They become larvae L1 to L3. Once it matures, it will now go to its head or proboscis so that when it goes to its next victim or when it feeds blood from its next victim, it will introduce again the L3 filariform to the skin of its patient or of its final host. So yan, that is the life cycle of Wuchereria bancrofti. What are the things that we should remember? If the microfilariae are not in the circulation, they live or they reside in the blood vessels of the lungs. Bakit importante yun? Kasi we will cover that, or it's part of the clinical manifestation of this disease. Kawawa naman yung lungs, no? Nananahimik lang sila, pero pinupuntahan sila ng ascaris, pinupuntahan sila ng hookworms. Ito naman, pinupuntahan naman sila ng Wuchereria or ng filarial worms. Kaya, kawawa talaga sila. Take care of your lungs. Yun lang yun. And then, what are the vectors for this parasite? Mosquitoes belonging to Aedes, Culex anopheles, Mansonia, and Cuculetida juxtamansonia. Next parasite would be the Brugia malayi, also known as the Malayan's filarial worm. Very similar lang ang kanyang mga characteristics. Ayan, skin penetration, infective and diagnostic stage. The habitat, however, is different. Instead of the lower lymphatic system, it inhabits the upper lymphatic system. Intermediate host is still the same. And however, it has a reservoir host. Ibig sabihin, they can also infect monkeys and primates and still continue their life cycle. Ano naman pinagkaiba niya sa Wuchereria bancrofti? Nuclei is irregularly spaced, so opposite. Meron din siyang sheath, but this time it has a high affinity to the gem sustain. This time, meron din siyang terminal nuclei. The cephalic space is longer, the appearance is kinkier, and the periodicity is still the same. So, almost opposite siya, no, ng Wuchereria bancrofti. You know, I would advise you to create a table for this one. Pagtabi-tabihin niyo yung mga magiging filarial worms para nakikita niyo yung pinagkakaiba nila. Sino dito yung naiiba, sino dito yung hindi pala na-sustain ng GEMSA, sino yung may terminal nuclei. And you can use that as your review material. For the life cycle, it's the same. But this time, you would find the Brugia malayi in the upper lymphatics, but the rest are the same. The vector could be mosquitoes belonging to Mansonia and Anopheles. The third one is Brugia timori. It resembles Wuchereria bancrofti, but for its other characteristics, similar din naman siya sa Brugia malayi. The host, mode of transmission, infective and diagnostic stage are all the same. Ayan, mosquito din siya. Ayan, Anopheles din. However, take note of this one, Anopheles barbirostris. Medyo specific tayo here kasi it has been noted really as an important vector for Brugia timori. Kaya tandaan nyo na lang, Anopheles barbirostris. Habitat is the same as Brugia malayi, so upper lymphatic system. For the morphological characteristics of its modified egg stage or microfilariae, meron din siyang terminal nuclei. However, just like Wuchereria bancrofti, it is not stained by Brugia timori. It has a longer cephalic space, the appearance is kinky, and the periodicity is nocturnal. So, medyo naghalo-halo na yung characteristics ng Wuchereria bancrofti or Brugia malayi. Para siyang anak nung dalawang parasite. For the adult stages of these parasites naman, they can get very large. Ayun, around 2.5 to 4 centimeters in length. So, imagine niyo lang kung gaano kalaking worm yung nagbablock sa ating lymphatic tissues, lymph nodes, ganun kalaki. And so, it can really cause lymphatic dysfunction. So, medyo malaki yung Wuchereria bancrofti. For Brugia malayi here, we have 200 to 275 and 310 for Brugia timori. And this is what they would look like under the microscope. Which is larger, female or male? Syempre, female ulit. Diagnosis, since again, the microfilariae are found in the circulation, we would use blood techniques such as thick and thin smear, Knott's concentration technique, membrane filtration. I hope you remember that. Serological tests are also available. However, this is really prone to they are prone to cross-reaction. So, babalik at babalik pa rin tayo dun sa na-mention natin before na serological assays or immunological assays are available, but they are prone to false positives and cross-reactions. Ano naman yung diethylcarbamazine test? So, diethylcarbamazine is actually a drug used for treatment. So, ginagamit siya for treatment. One of the steps in the mechanism of diethylcarbamazine is to encourage the microfilariae to enter the circulation. Kung na masyado pang maaga, ganyan. So, it will encourage them to go out into the circulation or to migrate from the lungs and to the peripheral blood. When that happens, it would be easier for you to detect them. Kasi kapag hindi ka sumusunod sa kanyang periodicity at nag-collect ka ng blood, you might have a false negative result. Kaya tayo magda-diethylcarbamazine proactive test. Bibigyan natin siya ng drug para lumabas muna sila lahat sa circulation and then we get the blood. So, kailan useful itong diethylcarbamazine? If we are studying nocturnal parasites, hindi mo naman pwedeng papuntahin siya ng laboratory ng 10 p.m. ng gabi o kaya ng madaling araw. So, we just administer this drug so we can comfortably or conveniently collect them during the day. Under the serological assay, meron din tayong skin test using Nemathelminthes. It is similar to the purpose of our hypersensitivity tests that we discussed in lesson 2, such as, ano ba yung mga na-discuss natin that time? Yung mga Cassoni test, Montenegro test. So, medyo na-explain natin yung principle nun, diba? Yung wheel and flare reaction. Kaya this time, we use a related filarial worm, which is Filaria imitis. Filaria imitis. For the pathogenesis, since it resides in the lymphatic tissues, puro may kinalaman sa lymphatic tissue ang kanyang manifestation, such as lymphadenitis, which is enlargement of the lymph nodes, lymphangitis, inflammation of the lymphatic vessels. Whenever you see yung ganyan, it refers to vessels or parang angioblast, yung cells that would create blood vessel. Kaya pag nakita yung ANG, it would most probably refer to blood vessels. So, lymphangitis, dito naman, inflammation of lymphatic vessels. Elephantiasis. Sabi natin kanina, if the lymphatic system cannot properly perform its function, there will be accumulation of lymph or fluid in our extremities or in our tissues. And the severe form of that would be elephantiasis. This is actually a product of not just accumulation of fluid, pero nagkaroon na ng mga infection dun sa fluid na yun, nagkaroon na ng scarring, and mas permanent na siya, irreversible na siya, nag-thicken na yung skin, kasi medyo chronic na siya. Ang tawag doon ay elephantiasis. Sabi natin, where do the microfilariae go when they are not in the circulation, such as daytime? Where can they be found? They can be found in the lungs. So in the lungs, they can also cause immune reaction or immune response by our eosinophils. That's why it causes tropical pulmonary eosinophilia. For these symptoms, they are specific to Wuchereria bancrofti. They could cause chyluria, or the appearance of lymph in the urine. So lymph and fats or milky urine and chyluria. Hydrocele, this is swelling of the scrotum. Kaya affected din yung scrotum when nagkakaroon ng accumulation of fluid doon. So swelling of the scrotum. Meyers and Cohen-Maer syndrome, it's related to what we call occult filariasis and occult filariasis. There is also a skin manifestation called soda. So medyo nangangati yung skin, called soda. And here are some pictures that could help you. Again, what is elephantiasis? It is the severe form of lymphedema kung saan masyadong marami na yung fluid na nag-accumulate, nagkaroon na ng mga subsequent infection, nag-thicken na or nag-scar na, nag-start na mag-scar yung skin, kaya medyo irreversible na yung ganitong manifestation. And so repeated ADLA means acute dermatolymphangioadenitis or lymphangioadenitis. Sorry. Ayun, ADLA is related to the subsequent attacks of the subsequent infection and also immune response that occurs in these tissues. Kaya ganyan yung nangyayari sa kanila. Ayan. So, the stages of lymphedema, kindly read na lang in this slide, but the most important would be yung elephantiasis, which is already stage 4. Under tropical pulmonary eosinophilia, dito naman there is persistent eosinophilia and we can get a false negative result. Kaya nga tayo magdi-DEC proactive test para lumabas muna sila at para makita natin sila sa blood. But without that, you will have a false negative result in your blood techniques. And if they cannot be found in the blood, you would find them in lung biopsy naman, where you would find the microfilariae in the lung tissue. This is related to the Meyers and Cohen-Maer syndrome, also known as occult filariasis. Kasi hidden. So akala mo wala, akala mo negative, yun pala nandun lang sila lahat sa lungs nagtatago. So occult filariasis. Manifestation of occult filariasis would be lymphadenopathy and hypersensitivity to filarial antigens. Or dito din papasok yung ating skin test using Dirofilaria imitis. This one naman is hydrocele, which is swelling of the scrotum. For the treatment, ngayon, gagamitin na natin talaga siya for its real purpose, which is diethylcarbamazine. We can couple it with ivermectin so that there is better performance or better suppression of microfilariae, and albendazole. We can use albendazole for Brugia malayi. Good news, last July 2023, it has been reported that 44 out of 46 provinces in the Philippines are already filariasis free. Before, it is endemic, but now we're getting there. 2 provinces na lang ang kulang. Aside from that, important vectors would be Aedes mosquitoes, specifically Poecilus and Minimus variant flavirostris. They are common vectors of these lymphatic filarial worms in the Philippines. Ayan, and that ends our first part for the filarial nematodes. In the next video, I will be talking about the other filarial worms, such as those that can be found under the skin and in our serous cavities. So until then, I hope you learned something from this video, and see you in my next recorded lecture. Thank you.